Hi, folks. I'm Bob Schrupp, physical therapist.
Oh, Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Neck pain and knots gone in seconds with trigger point. We're going to some stretches and posture changes. Big issue for a lot of people.
Right.
Brad.
And just as you could tell, my neck was bothering me, and how do you get rid of it?
It's annoying. I mean, and we've, kind of, because we're schooled in this field, we know all these different approaches you can try. You can kind of do a shotgun approach
Sure.
and try different things and see which works.
And likely you're going to find one or two of them that work well for you, and the other ones, maybe,
just
maybe
discard
not.
them.
Right.
So
one thing I want to clarify, Bob.
Oh, by the way, is that what you want to clarify?
Well, look, all the people out there. We just can't have them standing out there.
Welcome. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook and like us. It's really quite a sad tale. Brad and I, as children, were not liked, and we're starting to turn things around now by getting all these likes on Facebook. So,
All righty, Bob.
all right. Now he's
So, neck pain. If you're having neck pain and you're having pain, numbness, or symptoms down in the arm into the hand, they may work, but these are specific for. So if you're having that arm pain, we need you to go to one of our videos that specify neck and arm
pain.
Right.
Yeah.
Okay.
So we're talking about more. Do you want to show on me, Brad? Kind of what areas we're talking about?
Yeah.
You're talking about
right here, in the shoulders
Yeah.
and here. They're basically from here up. This
between
area
the shoulder
across
blades,
here.
that even might be some extension too.
Right.
Yeah.
But if it's going down past the shoulder, down in here, then you need to look
hand.
at more specific videos that we have. So, three-phase approach. It's like the tripod. A
Sure.
tripod's very steady. 3 legs, 3 different approaches. That's why this is guaranteed to work.
You need
for
to do
everyone.
all 3.
Right. Well, you
need to pick from each 3.
Right.
Right.
You might look out. One of them's going to work out well. The first one's a trigger point.
Sure.
Now, there's trigger points in your neck and your upper traps, okay, and that's in the levator scapular muscle, which we're going to show a stretch for that as well. But one of the nicest things for trigger point is to get on there with a deep soft tissue massage or a pressure point like the Theracane.
Yep.
Okay. If you don't have a Theracane, you don't have to go out and buy one. You can use a tennis ball. I'm going to show the Theracane one. So if you've got that knot in your neck and it's usually not up in here, it won't work so well, but it's for that knot that's down here, that pain right in here, and you're going to work that hook of that Theracane right here. That's why they got these handles on here. And we're going to hold that, and you'll find it. You'll get on it, like right now, I'm right on that point. Oh, and I'm going to hold it and once you get past 30 seconds, it should be one of those pains that feels so good, and then it releases. Once you put the pressure on, it might go up to like a 6 or a 7. And after 30 seconds, it drops down. Everything feels relaxed. You're down to maybe a 1 or 2. You take that off, and then you get some range of motion going, and everything settles down with it. Nice, quick way to do it. Again, if you don't have one of these, tennis balls work great.
By the way, this is definitely my go-to thing, Brad, and I do this a little bit different. I like to find the spot, and then I do motion with it. But
right.
That's just the difference between us two.
Right.
So,
and everyone has their own little
thing that works.
tricks of the trade, so to speak.
You want to show it on the wall?
The wall? Sure.
Sure.
Now, this is actually a sock with a tennis ball in it.
Yeah.
Okay. And the reason we do that is simply so you can get the placement of the ball in the right place. Because if you're by yourself and you take a tennis ball and you try to get to that spot, it's a little bit cumbersome.
And it may fall.
Yeah.
Too.
And here you got this. We're just going to drop it into that right spot, and we can hang on to it.
Now you can hold on to it.
There. And like this, you can do some rolling action on it, right to left, and you'll get on it. Oh, there it is. I got it, Bob.
All right.
Now that one, I already worked that one over. I'm going to do the other side. See how easy it is to change? That's a nice thing. You get a tennis ball.
See, again, to me, even with that, you could still be doing some neck motion with it,
so
in my mind.
Yeah. So you can go ahead. Would you like to do rotation with that, Bob?
Side bending, rotation,
Sure.
turning, get it. It just seems to work for me.
Right.
That's all.
And you feel it release while you're doing it.
Yep.
Yes?
Yes.
Bob was thinking of something else.
Yes, I was thinking of something else.
Okay. You can use a lacrosse ball. They're a little more aggressive. They're just
they're
firmer.
a lot harder.
Yeah, but
So-
that may work too. You can always play. You can play catch with them.
Yeah, that's right. Play with your dog.
Now, the other thing that you can do to actually accelerate this is if you put a hot pack on it. Okay, and one thing we really like as far as hot packs is we like the Thermatex The reason is because they're
It's infrared.
Right.
Yeah, this is really not a hot pack. This is infrared energy, which
Sure.
is going to go
deep.
deep. Yeah.
It's going to get in past deeper than 2 inches into that muscle
Right.
or into the joint.
A hot pack only goes a few millimeters.
Right.
This goes 60, which is 2.36
Right.
inches.
So you're going to get into that muscle, that tight muscle, and loosen
Brad
it
and I
up.
were just talking about this because we've kind of become, it's become a habit in our life where we just put it in our chair, and at night, especially on these cold winter nights,
Yeah.
we just, and this is the platinum one,
Mm-hmm.
and this works out really good because it covers almost every area of the body. You can use it,
So on this, I would sit in my recliner, and I
and
would
that's what I do.
put it like that up high. So
I like it because I get to the knots before they become really bad.
Sure.
And this just,
Yeah.
it gives me relief, and I wake up the next day and it's gone.
And you
So,
can combine that, heat it up for 15 minutes or so, and then go after it
Right.
with the trigger point with the Theracane or the tennis ball and get rid of that knot.
But this is really expensive to run. It costs, they figured, what, 4 cents a month to run?
I think it was a day if you left it on all day long.
Yeah.
Yeah, they're only 36 watts. Okay, let's go on to the key stretches, Bob.
Okay,
All
that's
right.
phase 2,
Right.
the stretches.
The first one, if you're working at your computer workstation or sitting and you got that neck pain there, you might want to find out or try some chin tucks.
Yep.
Start to stretch the muscles back here because oftentimes we sit with this poor posture, we're not even aware of it, and then we start developing that neck pain. So we need to straighten ourselves up, do some chin tucks, and you can do a little overpressure with that. In other words, on your chin, you're going to gently push in. I like to do it with that part of the palm right between the thumb and the pointer finger, but not real hard. You're not going to.
Yeah, don't you?
Yeah, I had one, Bob.
Well, I guess you don't now, Brad.
It fell behind here.
Oh,
There it is.
okay. The action's got to keep going here,
You
Brad.
bet. So now Bob and I do this a little bit differently too, and you can experiment with either way. I like to roll up a towel like this and just keep it handy. And after you do your chin tucks, you can start a chin tuck and hold here and just extend backwards. And this supports that neck and head and makes it feel real comfortable.
And you may think, why are we doing these when my pain is down here? This neck might affect the pain that's going on down
Right.
here. So
Neck pain radiates down into the shoulder blade.
Right, it refers what we call,
Right.
refers into that. It's just like, this is kind of a bad example, but when you're having a heart attack and you're feeling pain down your arm,
Right.
the damage is happening here in your heart, but the pain goes down your arm. So
Precisely, Bob.
So-
Good point. Okay, now the other stretch, you need to get up sometimes.
this is a
if you
nice
have-
stretch to
right.
do too.
Can you come over to the wall and just get your bottom up against the wall, your buttocks, your shoulders, and then bring your head so you can touch the wall. Now, there's going to be some people who have what we call head forward posture and may not be able to get their head to touch like I am. So you go back the best that you can, okay? And then you can put some over pressure. And then here, if your head does touch, I like to even stretch, and it gives me a little more. It's similar to the one in the chair, but you got the wall to support. And then you can
Gotcha.
put your shoulders back and do some wall angels, which works the posture of the shoulders. And sometimes if you just fatigue the muscles,
Yeah.
that'll relax that pain as well.
It's good, yeah, because it's covering the neck and the scapula
Right.
area.
All these
So,
muscles are
yeah.
connected. It's not isolated.
Yeah, I would
So-
definitely do the angels included with the chin tucks
Sure.
on there. So,
And lastly but not leastly is the stretch for the levator
Scapula.
scapulae muscle, which goes from the upper neck down to that shoulder blade. And here I got a pocket, and this is my Christmas shirt because a few days of Christmas here. And grab over here. You're going to look down in that pocket for some candy or something like
I'll
that.
go the opposite direction.
And we're going to go the hand down here. You lean until it locks the shoulder into place, so that's stabilized. We look down here, and I already feel a pretty good stretch. If you want a little bit more, just with your fingertips is all. Don't grab it with your hand because it's gentle stretch. And when you're doing the stretch, as well as the other ones, just relax and breathe. Good deep breath, exhale,
Oh, it
let it
feels good.
stretch. Yeah. I gotta do the other side, Bob.
I did the same.
Just to get balanced out.
I did the same.
Yeah, and boy, if you breathe and relax and let it stretch, don't force it, makes a big difference.
Yeah,
Just
think of this as our Christmas gift to you, by the way.
there
with
you
your
go.
Christmas shirt.
Yes,
So-
exactly. A lot of you thought I looked like an elf or something like that before pointing ears. I don't
Not too
know.
far off, I don't think. All right, number 3, posture changes,
Posture.
right?
Right. Now, we already covered the one.
back to the wall,
Right,
the
the stretch,
angels.
the
Yeah.
angels. Same thing that's working posture as well. But we're going to give you something a little more than that. Just let it fall down there, Bob.
I'll put it over here.
Okay.
So what are we doing now?
Well, let's go to the foam roller because this is one of
Sure.
our favorite devices to improve our posture. You need the 3-foot one, and it's nice to get the soft one.
Yeah.
We really like these from OPTP. You can see it on our preferred list below our video. But they're soft, they're comfortable. They're not too soft though. It's still firm. And right down the center of the back, and you can see Bob's posture is nice and straight.
This is kind of the lazy man or lazy woman's way to decrease the pain in your shoulders and such. The knots.
Well,
'Cause
Bob, I like to think of it as being efficient.
all right, there we go. But you know, it's stretching everything out, and you're going to think this isn't going to take away my knots. It may.
Right.
Just by getting in the correct posture and staying here for just laying here for 5 minutes.
Right.
You'd be surprised.
Yep,
It's just
exactly.
making a difference.
And then with this tool, you can still do some chin tucks,
tucks,
and
yep.
see if we can get a little more stretching along with the posture correction.
Yep. And like I said, we're stretching all the chest out. We're getting everything in the right pace.
I do want to point out for some people, if they do have that head forward posture I was talking about,
There's the arch up there too,
yeah,
Red.
it may be uncomfortable.
Oh.
My gosh, Bob, I'm sorry
Jeez,
about that.
Red, knocked my
normally don't-
glasses right off.
I normally wait till after the video's over before I hit you. But if your head does not go down because it's very uncomfortable, your neck is already contracted, you can put either a small towel roll or they make a nice little arch roll that goes right there, and that can be much more comfortable.
Yeah,
and
especially
then,
if your posture's not ready for it. So.
Sure. Yeah, and then after a while you'll be able to remove that and get into that good posture.
I think you knocked my glasses crooked, Brad.
Wow. Like I say, I normally wait till afterwards. But anyways, so those are some real key issues to get those knots and that pain in the neck, especially if you're really working overtime this time of year and you got to get rid of it.
It really a lot of breaks to help too.
Right.
You know,
Well,
not
I
just
feel so much better just doing them here,
That's
Bob.
right. It does make a big
So
difference. So
once again, we can fix just about anything except,
a broken heart.
there you go, Bob. And it's going to
Well,
come
we're
right
working
in,
on it
right
every
here.
day
Is it? Is it going
and
to
night.
right here?
Oh yeah.
Yeah, right here.
Right here. Thanks.